Well, we're here together with a good friend of mine, an associate in the same South Florida community, Dr. Bruce, that's his dad, Dr. Adam Clarin, one of the top optometrists. I say that, he's not listening to me when I say that. So, but he's the person I go to for my eye care. And I would say that of the few different optometrists I've been to in my life, the care at his office is very uniquely different. It's highly specialized. The care, there's a lot of attention to detail, like my wife likes to say, and that causes me to feel like that's the place for me. I'm not looking for a quick in and out in terms of the cost. I'm looking for the high quality and high touch service, and their office gives that to me every time. So I appreciate that, Doc. Good morning.
Thank you, Doc.
All right.
Appreciate that.
We were talking just a little bit before we started, and we're just having a little conversation here. So there's Jerry Seinfeld having the coffee with comedians. I don't know if my jokes will be that good, so I'm going to stay away from that. But
go ahead and get my coffee.
There you go. This is discussions with docs about just things going on. So we're starting the new year, and what we both have a concern for, because you have children, I have now grandchildren, is kids have concussions. They have impacts to the head, and they're notoriously difficult to diagnose and to identify, right? So we're talking about a paper here. So tell me a little bit about what you just mentioned with children and concussions.
Well, we know that concussions affect the brain, affect the eyes. And the problem we have with kids is that we don't have the baseline data we need to help determine that.
Right.
So kids can have developmental disorders, or they can have TBI. And sometimes it's hard to tell the difference. But if we were able to find a way to test kids as a baseline, either pediatric exams or at the schools, to get data on eye movements, on brain function, then, if it, God forbid, anything ever happens, we'd have data to compare to know where we are, where we need to get.
Well, that's very, I like the contrast between developmental and then concussive type forces that change some of the, we'll call it oculomotor, how their eyes move, how their eyes track, not necessarily.
And how their brain processes visual information.
And how their brain processes even better. So I was holding up a paper I've done a lot of scratching on already for people, not that they're going to be interested in that like we are, but this just came out November 2020. It's original research on eye movements as a biomarker for kids' concussions. Very important. And we know that children, young people, have the highest number of concussions or TBIs in the country. So it's an important group. Kids have these injuries. I suspect that I've had around 8 to 10 concussions growing up playing football and pole vaulting and different things that I was involved in.
I'm learning a lot about you.
Yes. I mean, were you involved in sports and growing up?
I played basketball my whole life, and I've seen my fair share of head injuries. I growing up, I don't think it's on the top of your mind. I was an out of control, aggressive basketball player, so I hope to think I caused more than I got. But looking back, maybe a step slower would have been a better move.
Wow, maybe that's why they call you the enforcer. I thought it was about the policies in your office. No, but this is really important. I know that you also teach or have taught last year or the year before with, was it with Neuro Optometric Rehab?
I am a member of NORA. I've gone to some of their meetings. I've attended, obviously, many lectures on TBI. I didn't actually give any lectures or teach, but I'm an avid learner.
Yes, that's it. We have to stay sharp and fresh. And many people that are working with children may not be as up to date on this information about the eyes and the eye tracking as a biomarker. So I would even say this, I was thinking to a parent, we're both parents, and I'm also a grandparent like your dad, but to parents, can you say without a shadow of a doubt, unequivocally, that your child has not had a concussion? I think the answer has to be legitimately to somebody. I mean, I'm not 100% sure, but I'm pretty sure. And that's because they're looking.
I've seen my son take a soccer ball off the head.
There you go.
And actually, my daughter, after a minor medical procedure, fainted and hit her head. And the first thing I did was have her come to the office. Wow. And, just like the shoemaker's kid doesn't have shoes, I didn't have baseline data on her before that. Luckily, through the eye movements, everything seemed okay. But it would have been nice to compare.
Yeah, well, now I have my own. That's good. You remind me of my personal stories. When my son, who's 32, was 5, he climbed up a wicker thing with a television and it fell over on him. Television hit him right here. Both black eyes, hematomas. You know, I didn't understand what to look for at that point, although he didn't have vomiting and some of the classic signs we used to consider, but we don't know. And then my younger son fell and hit his head playing in a room and hit his head on the side and ended up with his head tilted for a long time, but seemed fine. But now we realize, we have looked at his eye tracking, of course, both of them, and we see that there's some aberrancies, some abnormalities, and who's to say, maybe those things created that imbalance in them at that early age. Hard to know.
True.
So very important for us. I mean, we're both considering that for children, and it's something that's close to our heart, and our wheelhouse is helping helping parents identify these things early. And so this is part of our desire. Anything else? Tell me a little bit about the convergence insufficiency we were talking about.
Oh, well, convergence insufficiency is a very common post-concussive symptom or problem that we see, along with accommodative issues, spatial awareness. So as simple as bringing a non-accommodative target up towards the nose and seeing where their two eyes break down.
So it would be kind of like they would be watching their finger here and you're looking for one of those eyes.
Correct.
Okay.
Correct. And when I do it, I tend to use red-green glasses and a light, because that sort of breaks down the system a little more and takes away some of the cues to keep it together so I can get a truer assessment. But that's not something that's done everywhere. Not every optometrist, certainly no pediatricians are collecting that data on kids. So again, when that happens post-concussive, is that the concussion, or where was their baseline? We don't know, because obviously we see kids who we have no reason to suspect concussion, they still have CI.
Got it. Well, this is good. So just a little short time here talking together about pediatric concussions. The biomarker is eye tracking. We both use right eye systems in our office, among other technology, and this is some of the paramount technology. It's really helpful in identifying and documenting how our children's eyes are tracking after they have a head bump, let's call it. Sometimes a parent will say, no, they lightly bump their head, because I don't want to admit things with my kids. I mean, I see.
You don't even need to bump your head to have a concussion.
Exactly, right? Now we can just move the head in a quick way, like almost a whiplash type of activity.
Correct.
And now you get that motion in the brain inside the skull. So a quick morning touch base here with Dr. Clarin from Clarin Eye Center.
Perfect.
There you
Clarin
go.
Eye Care. That's
in Palmetto Bay. Yeah, one of my go-to guys. And actually, I got to get in there. And I was thinking of you early in the pandemic. I hate even saying the word, because of having the glasses and the mask on. And then my glasses fell off and I have a scratch. And as soon as that happened, I was like, okay, I got to go and see. This was like,
listen, come in for that scratch warranty, before it's too late.
I'm in.
Switch that lens out for you, no problem. But the mask fog is another issue.
It's another issue.
That blur hasn't caused anybody to bump their head.
All right, that's right. We don't want that. We don't want that. All right, Doc. Well, listen, have a great day with patients, and thanks for jumping on here with me.
You as well. Take care.
Bye-bye.
Bye.